Thank you so much for coming today. Today is our very first town hall of this package deal. We're really excited to be offering and partnering with UVM, offering 10 CEUs for 8 town halls throughout the school year. We hope that they are some really good topics that you guys are interested in. These topics are based on the surveys that we have done after our conferences and before the Working Together conference of what topics school nurses were interested in knowing more about. So today our topic is free resources that are provided by the network of National Library of Medicine. We are lucky to have Sarah Levin-Lederer here today. She has her master's in public health, and she is the outreach and education coordinator for Region 7 of the network of National Library of Medicine. And Region 7 is New England and New York. And she'll explain more about herself and the regions in her presentation. So thank you for being here today. And Sarah, without further ado, take it away. Thank you so much for being here.
So thank you for having me. This presentation should be a little bit of me talking. There'll be a live demo, and then I encourage you to try out the resources as well. It's like I've built some time in for that. If there are any questions, please feel free to throw them in the chat and we'll get to those as well. As Becca said, my name is Sarah Levin-Lederer, and I am an outreach and education coordinator for NNLM Region 7. My background is in public health, not in libraries. A lot of times when folks hear National Library of Medicine or network of the National Library of Medicine, there's an assumption that it's all libraries, that we only partner with libraries, and that our staff is all librarians. I come from this, like I said, with a public health background. So I view the resources slightly differently, and hopefully that will help me be able to connect you with them in a way that makes sense for what you do. So the first thing I'd ask is, and I can only see 4 people, but if you could sort of indicate either in the chat or raised hands or something to say, is anybody familiar with the network? Let's see a couple of hands. Okay, if you could pull the hands down. Is anybody familiar with the National Library of Medicine? Few hands. Okay. Are people familiar with things like PubMed, Medline Plus, clinical trials.gov, history of medicine, PubChem? Okay, so I'm seeing some more hands on that one. And that's, yeah, and some yeses in the chat box. So that's generally what I see with my non-library partners, that there are more people familiar with the products than with either the library or the network. So just to sort of situate everything, the National Institutes of Health, the National Library of Medicine is an institute of the NIH, even though it doesn't follow that sort of naming convention that we're all used to. The network is the outreach arm of the National Library of Medicine, which consists of 7 regions and then 4 national offices. We have an evaluation office, a public health coordination office, that's 2, training office, and I'm missing the 4th one, but they are specialty offices that help all of us in the network in our regions, and then also help support what we do, and are also often available to our partners as well. And then under that are specifically the regional medical libraries. So that is where our network is. It's each of the libraries that we are hosted at. The National Library itself, like I said, is an institute of the NIH. It is a physical library in Bethesda, Maryland, on the campus of the NIH. So if you're down there and you want to go see, there's some very cool archives and history of medicine and old documents and things like that they have. But the library is also then one of the federal government's largest providers of digital content, with about 200 products and services that exist online. And these products, the digital content is free. So like, I'm going to be talking about specific things that I think are applicable to what you do, but there are other things, some very specialized databases that, for epidemiologists, biochemists, folks like that, who may be in those that aren't necessarily for everybody. But if you're really interested in chemistry, biomedical chemistry, there's a database for that, things like that. So then the network, like I said, is the outreach arm of the library. We are here regionally located to be responsive to the needs of the communities that we serve. And so part of that is this idea of providing researchers, health professionals, public health workforce, educators, the public with equal access to biomedical and health information resources and data. And then to do that through this idea of developing approaches to promote awareness and improve access to the resources that the NLM creates and maintains. So trainings like today's to let you know what's available, develop and support a diverse workforce to access information, resources, and data, and support data-driven research. So we have interns, we work with library schools, we work with schools of public health to help folks coming into these professions know that these resources are available to them as students, and then also to them as they go forward in their careers. And then finally, provide community-driven innovative approaches and interventions for biomedical and health information access and use. And so that last point, I'm going to outline some of the things that we specifically do in our region that are available to you as services if you're working on something or you need some support, that hopefully we can connect around those things. So Region 7, as Becca said, is the 6 New England states plus New York. New York was a recent addition to our region in the last 2 years. And it really changed a lot how we do things and how our area is. We've doubled in size and we've doubled the population that we serve as well. So then Region 7, we are located at UMass Chan Medical School in Worcester. So again, since this is region-based, we are here in the region. And there are actually 4 outreach and education coordinators. So people who do things similar to what I do, but have different primary focuses. So my primary focus being public health, emergency preparedness, climate change, and environmental health, and then also graphic medicine. And I'll talk more about that when I talk about the special initiatives. So some of the things that we do, like I mentioned, that last objective on the other side about providing support and connecting with our communities. We do focused outreach, grant funding and support, teaching and training, and then our special initiatives to address that community-based, community-driven approach to making sure that people have access to these resources. So I wanted to start with focused outreach because it's something unique that we do in Region 7. And it's also what brought me to the Vermont State School Nurses Association in the first place. Focused outreach is a year-long process where we have identified 2 geographic areas that we want to put special attention into for that year. And it's a process of building relationships or strengthening existing partnerships and a way to really target some training, some outreach. And it's the basis of focused outreach is a semi-structured interview with community partners. And it's a way for us to learn about the health needs and the health information seeking behaviors of your communities and the people that you serve to help us better serve you in return. And then also to strengthen, again, these connections, making sure that the partners in those areas that we were focused on for that year know about our resources, know about the training, know about the funding that's available, the projects, things like that. And so then for this year, one of our focused outreach areas is the 4 northernmost counties in Vermont. So Grand Isle, Franklin, Orleans, and Essex counties. Myself and my coworker Benny are doing our focus, or the semi-structured interviews, the key informant interviews. We're doing trainings with various partners. We are making sure that folks are aware of funding, things like that. And so if you work in any of those counties, we would love to include you in the focused outreach key informant interview process, or if you know somebody in those counties who might be interested, please reach out and we will schedule a time. It's about 30 minutes, and it's really helpful to us because we learn a lot about the unique needs of these areas. And so then, since it's 2 areas within our region each year, my coworkers Margot and Sean are focused on on Berkshire County in Massachusetts this year. I mentioned that we do have some funding streams for small. These are, up to 15,000. Short. These are year-long projects. And so if there's something that you're thinking about, that you're looking for a little bit of money, a lot of times people are potentially piloting something that they've been thinking about for a while, and this is just a chance to, 1 year, get it done. Our CFP is probably coming soon, especially since our year runs May to April, and we want to make sure that folks have enough time to get that in, want to make sure that we have enough time to let folks know if they've been awarded, and so that they can hit the ground running in May. Funding is available to any NNLM member organization, and membership is free. So that is not, we are not a paid membership organization. Categories for funding include health information outreach, technology improvement, and that's a big one. We recognize that the digital divide is a huge issue, especially for folks trying to access our resources, which are pretty much exclusively online. And then there are a few smaller categories that change from year to year. In the past, we've had collection equity awards mostly for libraries who are looking to fill some gaps in the health information collection that they have. We've had some data awards in the past for organizations that have been looking to better either analyze or store data that they have. And then we also provide support, because one of the things that we know is that, especially for our smaller partners, grant writing is hard. Our larger partners, the universities that we work with, a lot of times have departments that will write grants for them or help them polish things up, things like that. But it's an equity issue. We cover small organizations, large organizations. And so we really want to make sure that we're providing support to our smaller organizations to make sure that they have an equal chance to receive funding. And so we are available to review draft proposals, to meet, to talk through ideas, to see, which might make the most sense or how to sort of structure it to work the best. We also provide support throughout the year for reporting, invoicing, and then we also provide training and technical assistance. So if your grant says that you need to be using Medline Plus or that you want to use Medline Plus, we are available to help make sure that your organization and the folks within your organization feel confident using Medline Plus. So teaching and training also takes on this sort of national and regional focus. We partner with our colleagues in other regions to provide a slate of classes, webinars, on-demand classes. So things that would fit your needs. Don't always have to go to a live class. There are asynchronous classes, there are on-demand classes. Topics are, a lot of the topics are library focused, since that is sort of the largest percentage of our audience, but we do have quite a few public health focused, health profession focused classes, and quite a few classes that are on emerging topics that sort of span the entire audience of the network. Again, all of our classes are free. And we do provide CEs, CHIS and MLA for our library partners, and then CHES for our public health partners. Unfortunately, we don't at this time have any nursing specific CEs with our classes, but that is something that has been floated and may become available at some point. And then there's also a yearly symposium on relevant and or emerging topics. This year in the spring is going to be a health misinformation symposium, all virtual, all free. Again, CEs for the categories that were listed. So those are really our more national focus, but we also do have regional focus in our teaching and training. And it takes sort of two There are sort of two ways that we are regionally focused. One is trainings like this that are specifically for partners within the region, for funded partners, or folks we meet through focused outreach, or folks we meet in other ways, specifically for organizations in our region. The other is highlighting regional partners and the work that they do. And so a lot of times these regionally focused webinars are also open to our partners in other regions, but we develop them specifically to address the needs of our region. So topics that are of interest to our region, partners within the region. We've had some really good grantee report backs where grantees will talk about what they did, how they did it, if somebody wants to replicate what they did or part of what they did. Things like that. And so we really want to promote our region and the folks that we work with as well, and the great work the folks that we work with are doing. So then I mentioned special initiatives, and so we have quite a few, and this sort of comes into play with each of the coordinators has sort of a primary audience, but then we also have a primary interest area. So my colleague Margot, she works a lot with hospital librarians. That is her where her background is, and so she is very well versed in their needs. We all work a lot with rural health and issues of rural health, given that we do cover New York City and Boston, but large swaths of our region are very rural. The areas like central New York, northern Vermont, northern New Hampshire, large parts of Maine, incredibly rural, and they have their own needs. My special initiative is graphic medicine, which is graphic novels or comic books that have a health or wellness theme. And so graphic medicine is a way to increase health literacy. You connect more and you remember more when something is presented to you in the form of a story. You connect to characters more than you do little stick figures on an infographic, and it helps folks remember characters in a graphic novel. presenting things as, a character and a story helps build empathy in relation to whatever the health topic is that you're reading about. And so with the special initiative, we have a group within our region that meets regularly who meet regularly about how they use graphic medicine, how we can share it with partners who aren't sort of involved in the graphic medicine community. And then also use it as the ability to call on those folks to do some trainings, some of our webinars, act as subject matter experts. We also have graphic medicine book club kits. And so this is a program in a box where you get, again, for free, we pay for shipping and return shipping, 6 copies of a book, discussion guide, and supporting health information. And so we have had these book club kits run most often in health science libraries, but also in public libraries, and then a few times in high schools. And so if you have a group of students who might be interested in doing a book club and using a graphic novel as a way to talk about a health topic, this is available to you. So there was a question in the chat for ideas and information on providing information and training in Spanish to rural agriculture workers, specifically Stop the Bleed and immunization issues. So when we get to Medline Plus and the demo, Medline Plus is completely available in Spanish, and I will show you that. I'm not so much with specifically Stop the Bleed, but this actually is a great question coming off of the explanation about graphic medicine, because there is an amazing graphic medicine initiative called El Viaje Más Caro, which is actually the Vermont State Read this year. And so it's a project that was done with cartoonists and the Vermont Folklife Center. They interviewed agricultural workers and made comics that explained their experience. And so they produced them in both English and in Spanish. The Spanish versions were often used in clinics to sort of open a conversation about what the patient might be experiencing. And then the English ones were left around towns. They were used in community meetings to encourage dialogue about the experience of migrant, mostly dairy farmers in Vermont. So I am going to switch over to a live demo of Medline Plus and PubMed. I would encourage you to open both, because there will be a chance for you to try them out and ask questions with me here. So medlineplus.gov and pubmed.gov. But before I do that, are there any questions specifically about the network, what we do, what's available, or the National Library of Medicine? Feel free to throw some questions in the chat as they come to you, but I'm going to, like I said, switch over to a quick live demo of Medline Plus. So Medline Plus is, oh, I just remembered I put another slide in that explains what Medline Plus is. There we go. So before we get to the live demo, Medline Plus is health information in plain language. and it's sorted in a lot of different ways, in a lot of different categories and places on the page. And it's supposed to help folks, because we know that people search differently, will, the logic for finding something is different for each person. So the ability to search by health topics, or to go straight to a drugs and supplements page, or to put something in the search box like it's Google, all of these are ways to help people access the information in different ways. So there's a question about the graphic medicine book club kits. There are two that are specifically for middle schoolers and older, the emergency preparedness one, and there's one now for familial substance use. The other ones can be used and have been used by high school age students and older, but I would recommend that whoever's running the book club kit read the books first, so they are aware of the contents and and are ready for any questions about that. So for real this time, I'm going to switch over to the live demo. So like I said, Medline Plus is health information in plain language. So this is the National Library of Medicine's health information for the general public. So it can be searched. Like I said, we can put a topic or a search term into the search bar like you would any search engine, or we can use any of these links, and the links are very similar along the sides. And so is there a health topic that you would like to see used as the demo for Medline Plus? Asthma, that's a good one. So I'm going to start with putting asthma in the search box, and you can see that it does generate suggestions the way that Google does as well. So if you are, want to refine by asthma triggers or asthma control drugs, you can do that right off the bat. If we just put in asthma, we get the result page. And so right at the top is the link to information on Medline Plus. And so this is links out to the health topics page. And so a health topics page is really more of an aggregate of information and less of a full overview of a health topic. So in this case, you get a very basic summary, and you do get links to useful information that you can continue to search through that way. But then once you get through the sort of basic overview, the health topics page is going to give you links. And these links are going to be to resources that have the same quality standards as Medline Plus. So science-based, reliable, no advertising, free. So you're going to see a lot of other NIH institutes. You're going to see the CDC. You're going to see other health and human service agencies. So the EPA in this case. You're going to see things like the American Academy of Family Physicians, or if you're looking at something like heart disease, you're going to see the American Heart Association. If you're looking at diabetes, you're going to see the American Diabetes Association. You'll also a lot of times see clinics. So the Mayo Clinic, for instance, comes up a lot because they also have some very good free patient education materials. Got the FDA, American Lung Association. And so all of these links mean that the health topics page is a good place to start. It's not necessarily limiting you just to that information, but helping you to connect to other resources to continue to learn more about that topic that you're looking at. So related issues, specifics, genetics, images, videos and tutorials, games, especially a lot of the health topics that are often have a lot of that affect kids a lot. There will have games that certain organizations have made to help educate. Those links are there, and then also journal articles. And so we'll talk about PubMed later, but this is a way then to connect that patient engagement, patient information back to the research, the published research that's out there. And then at the bottom of the page, you get demographic specific and then patient handouts. So I'm going to scroll back up because there are a couple of things on the right-hand side to also point out. All of this information is designed to link back to itself. So if you start at one place, it will come through, to make sure that all of the information is complete. Trying to paint the most complete picture. So if you are looking at this overview and you have a question about what do they mean when they say household chemicals, you can click on the household chemicals link and it'll take you there. What do they mean when they say colds and flu? Things like that. But then at the same time, there's also this sort of more information panels on the side. So the medical encyclopedia, and I will actually show you what that looks like because it's different information there. The related health topics. So this is going to these links will give you a similar page to what we're looking at here with asthma. So the brief overview with all of the links underneath it. The Institute of the NIH that specifically covers whatever health topic that you're looking at. Information in other languages, and I'll come back to that as well to highlight specifically how to find information in other languages on Medline Plus, and then also resources from the Medline Plus magazine. So before I go to the medical encyclopedia, I'm actually going to go back to our search results because there are a couple of different ways to filter the search depending on what you're looking for. So if you only want the health topics pages that are related to whatever topic you searched, you can filter it that way. If you only want the medical encyclopedia pages, if you don't even want Medline Plus resources, but you want the external links, you can filter it that way. And then you can also filter it by the different sections that are available on Medline Plus. So I only want to know about medical tests related to asthma. I only want to know about genetics related to asthma, drugs and supplements. I only want the information from the NIH, Medline Plus magazine, and then the multiple languages. Or you could refine it by format. So like if you really are just looking for a patient handout, you can click on PDFs and get that more printer friendly. Well, I don't want to do your survey. I would skew your results. You can get those more printer friendly handouts. So like right here, we have one that's specifically from the National Heart and Lung Institute that's about asthma and physical activity in schools. So we can also refine the search. So you can also refine your search in the search bar. So if you said asthma in schools, and you actually see that it does have that as one of the suggested topics. And then you can see that, fewer results for that might make it a little bit more manageable. So you can continue to refine results either on the left-hand side or through adding terms. So I'm going to go back to our health topics page. and then click on the general asthma medical encyclopedia entry. So the health topics pages are aggregate pages. They're really designed to be a place for links and place to go for more information. The medical encyclopedia is really that full overview of a health topic. So it's, what are the causes, and including some pictures, and in this case, there's a whole list of triggers, but again, it still includes links to, learn more about terms or things that people might not be familiar with or want to sort of brush up on. Well, what does Medline Plus actually mean when it says common cold, things like that. So symptoms, and so again, these aren't the links that we saw on the health topics page, but an overview written out, exams and tests, treatment, prognosis, complications, medical professionals, prevention. So, and then some information about patient instructions as well. So those are sort of the two big kinds of pages you'll find on Medline Plus, the health topics page and the medical encyclopedia. And I said at the beginning that there are sort of different ways to search Medline Plus because not everybody comes at the information the same way. And so you can find health topics pages by using the health topics link, and then it helps you sort of break down. So you could look at an entire list of all of the health topics pages that are available on Medline Plus alphabetically, or you could think about it in terms of diseases and conditions, like what is the overarching, if you're interested in finding out more information about cancer, you click on the cancer link, and that gives you an alphabetical list of all of the different cancer health topics pages that are available. If you're looking more for the diagnosis and therapy, health and wellness, or population and demographics groups. So click on the children and teenagers, and you see all of the health topics pages that have information on them specifically geared towards children and teenagers. And so we can come down here and see the asthma in children page. And if we click on that, it comes up looking, the way that you're getting, starting to see the pattern there with the brief summary, and then not so brief in this case, and then the links, and that can help you go out and find more information. So if we come back to the health topics page, I've been ignoring the body location and system because this one is a little bit more in depth, but very cool if I do say so myself. So if we come down to the lungs and breathing, not only do you get a list of the health topics pages, but you get this really interesting diagram. So you can say, I just want the lungs, the health topics pages that are affected by the lungs. And again, we see our asthma and asthma in children pages. And it nasal cavity. So, when you use that, you can sort of start to associate some of the health conditions with the parts of the body. You can really visualize the different systems and things like that, but then also have this full list of the various health topics pages that are available on that. So I'm going to just go across to show you what's in each of the other sections, and then I'm going to come back and talk about how you find health information in languages other than English. So just real quick, the drugs and supplements page, you have your related health topics. You have, you can browse by the generic or brand name. So you click on the letter and you get that list. So like if I wanted to do Tylenol, I can come down here and down here. Apparently T is a long list. So, you can find Tylenol and it directs you to the acetaminophen page. But you can also actually do that in the search bar. So let's see how well I spelled Tylenol. That's not right. There we go. So you can, again, do that in the search bar as well. Put in the brand name and it gives you the generic name and the information that goes along with that. And then it also links out to the all herbs and supplements. So if you have a question about ginseng, if you want to learn more about the actual published research about whether or not ginseng is good for cold and flu, things like that, the herbs and supplements information is there. So, genetics. So genetics, you can look at conditions, you can look at information about genes, chromosomes, and then tutorials to help folks understand genetics. And then the medical tests. So the medical tests are really useful for folks who may have been told that they need to do a cholesterol screening. That may not be as applicable to your students, but maybe they've been told that they need an ADHD screening. And so then this is, what is it used for? Why would it be recommended? What's the actual process of the screening? What can folks expect during that time? Will they need to do anything to prepare? So for things like a cholesterol screening where you might need to fast, that's the kind of information that would show up in the anything to prepare section. Any risks. So this is a written and physical exam, written test, or questionnaire. If it's a test that might need to draw blood or anything like that, that might come with even a marginal risk, information would be there. And then help sort of understanding what the results might mean. And so then this gets back into that patient education and the health information in plain language. So sometimes when we are working with medical professionals, they may use terms or, have assumptions about what people understand, how they're approaching it. And so this is, again, a way to take that very specialized information and try to bring it to folks who don't have that specialization. And then just general information. And again, you could put any of this information into the search bar and come up with these things as well. So like if I just put ADHD into the search bar, it would give you the health topics page. It would give you the medical encyclopedia page. It would give you the links out to the other trusted resources, and it would give you the links to any information that might be in the genetics section and in the medical test section as well. So videos and tools. This also includes a link to some games. and also a link to a tutorial for evaluating health information online. And so back to the discussion about misinformation. So the network is having a symposium in the spring about misinformation. One of the big things is, are we training ourselves, our families, our friends, and students to better evaluate health information online? And so Medline Plus has its own tutorial about that as well. The one section that doesn't have a banner link is this healthy recipes section. It is what it says it is. I'm not going to click into it, but if you're really looking for some ideas, you can always try that out as well. So the last thing that I want to point out about Medline Plus is how you find health information in other languages. The first thing to know is that you can always toggle between English and Spanish. The entire site is available in Spanish as well. So, you can search, you can do this, the other ways to access information. So if I toggle back to English and then go back to the asthma page, you can always, any page you can toggle back and forth from English and Spanish. So if you're, you search for the information in English, but you want it in Spanish as well, you can toggle it to the Spanish information. And that's true of the medical encyclopedia pages as well. So if you are looking to print out that information and you want, some handouts in both English and in Spanish, that's available. So Spanish is the only language that Medline Plus is available in completely other than English, but there are other language resources available for some languages and for some health topics. And so there are really two ways to find that information. One is if there is health information on that specific topic in a language other than English, there will be a box on the right-hand side. And if you click on that, it will give you a list of the languages that have health information available on that topic, and then the links to those resources. This is really handy if your community is dealing with a specific health topic and you want to see if the languages that you need are available. And so these, the translations have to go through a similar vetting process, and they have to be professionally translated. So these are not just, somebody's cousin made a translation. These go through professional translation as well. So that is the first way if you're looking for languages other than English on specific health topics. The other way is if you serve a community that has a specific language need, you can find all of the health information in that language if you scroll to the bottom of the homepage and then click on the health information in multiple languages. And this will bring up a list of all of the languages that have any health information available on Medline Plus. So if your community needs health information in Haitian Creole, you can click on that and then you can see which health topics have information in that language.
If anybody has any questions, if you want to raise your hand, we'll call on you, and then you can unmute and ask the question. Go ahead, Claire.
If there's a subject you're interested in another language that they don't have either the language or the subject, can you get in touch and say, hey, how do I find this?
So there is, let's see. So About Medline Plus does have, nope, that's not it. So there is a way to suggest changes or to recommend your own resources. So that's not exactly what you're asking, but if you did have a health resource in another language that you wanted to share with other folks, you can submit it. I will have to find that and send that information along because it doesn't appear to be where I thought it was. But there is a way to contact the folks who are specifically tasked with maintaining Medline Plus to ask questions about, is such and such health topic coming? Could we see something about that? Things like that. The languages are a little bit harder because a lot of the translation is being done by other organizations and then sort of given to Medline Plus. So they're not actually creating those things, but they are sourcing them and holding them for folks to use. And so it's not as easy in that sense to say, hey, could you make XYZ?
Okay, thank you.
So I'm actually going to ask folks, do you want to take a little bit of time to play around with Medline Plus and see if there's anything that comes up that either is really cool that you want to share, or if it generates any questions, or do we want to go straight to the PubMed demo? So PubMed is a way to search for biomedical research and biomedical literature. And so this is really the what's the new, what's the best practice, what have people been studying, especially if you're looking to sort of underpin a new project, what else have other people done, what are the results, things like that. So this is more of the traditional academic database kinds of searches. And so for our library partners, they're doing things like building searches, monitoring searches, doing really deep dives. But the nice thing about PubMed is that you can search it without having to put in ands, ors, modifiers of any kind. So we can just put in terms and come back with usable results. So if we take our asthma example from earlier, and then you can see again, it is suggesting some things. But if we just search asthma, we're going to get a lot of results. It's going to be too much. So if we search asthma, children, and exercise, let's think about it. Intervention. We still get a lot of results. So we're looking at almost 3,000 results, but we can do quite a few things to filter these to make it useful if you're looking for something specific. I have been sort of hammering home that these are free resources. This is the one place where there are things that are going to be behind a paywall. Because PubMed brings together research articles, some of the journals that those articles are published in may have a paywall. If you have access to an academic institution, things like that, you may be able to you may have access to those articles, but if you don't, and you really just want a broad overview, you can limit your search to the free full text. And that already brings us down to less than 800. And then you can, think about if you only want clinical trials, if you only want systematic reviews, if If you only want randomized control trials, you can sort by that. If you only want in the last 5 years, you can create a custom range. You can also create a custom range up here with the sliding scale. I only want systematic reviews. And I only want from the last 5 years. And so now we're down to 17, which is a lot fewer than what we were looking at when we started. There are additional filters. So longer lists of article types, not just the default that I think 5 or 6 that we're showing. If you are looking for animal studies, you can either limit it just to humans or just to other animals. If you can search for articles in languages other than English. The vast majority of articles on PubMed are English language articles. And then if you want to, so we put in asthma in children. If you want to define an age set, so if you want to say, actually, I only want to know about preschoolers and asthma and exercise, you can do that as well. So there was a question in the chat about setting parameters and filters and saving them for future searches. You can do that. It is you can do that, and you also can set update emails as well. So like you could set a search and have it email you every time there's a new article that fits your parameters, instead of having to run the search repeatedly. So I'm just going to pick this article here. So effects of physical therapy, lung function, study protocols for a systematic review, to give you an idea of what's available. So this is just the abstract, but we did set our parameters to free full text. So if we come to this side, we can see the links of where to get the free full text. In this case, it's up in PubMed Central. And then you can also expand your search by looking at the similar articles that are recommended. You can come down to the references. And on some article pages, if that article has been cited. So, if you build a search and you're only getting so many results, you can always find other results by expanding to the references or by looking at what other articles have cited the one that you're looking at. So then you can also come down to the mesh terms. So the mesh terms are medical subject headings. And so this is a controlled vocabulary that PubMed uses, and it's a way to take terms that may have other terms associated with them, or that you might search one term, but most things are falling under a specific term, and to expand your search that way. So in this case, you can see that we have, when we got all of those results at the beginning by just using asthma, children, and exercise, the mesh terms in that case can help refine the search by saying, well, there's a mesh term for asthma and therapy. So are you really thinking about it in terms of asthma and asthma therapy? Or are you thinking about it in the physiopathology or the causes, things like that? So another one that I have used, so when we're talking about folks who, looking for research articles for communities who may be English language learners, English as a second language, there are multiple different terms that can be used for folks whose English isn't their first language. And so if you try the different terms, you'll find that there aren't a lot of articles for certain terms. But if you find an article you like, you can scroll down and see what the mesh term is and use that to broaden out the search. So this is a very rudimentary overview of PubMed, more in depth with Medline Plus, but I did want to make sure that you were aware of it and aware of the basic searching capabilities. Are there specific things on PubMed that we either want to try another search or click on any links to see what that brings up, anything like that?
Looks like Clayton has a question in the chat about default settings for results. Or can you set up filters and save them for future searches?
So you definitely can do that. That is not my area of expertise in terms of pulling from PubMed. So if we go back to the search results, you can see that you can save. You can email it to yourself or send to. You can create an RSS feed for it. You can create an alert. You can also go into the advanced settings and search in, enter other information. So additional search terms and have it search in very specific areas. So like if you wanted to do this search free full text in the last 5 years in a specific journal, you can do that as well. And then you can see that how it on the back end has built this search. You do need an account to set up an alert, save searches, things like that. But again, the account itself is free and the ability to save the searches are free.
Dusty, did you want to unmute and tell us what you wanted from the chat?
I think it's *9 to unmute.
Or *6.
I think that's it.
You got
There we
it.
go.
You got it.
Sorry, I'm
That's
not good
okay.
with this shit. Yeah, we were just debating, I know there's mandatory protocols for like high schools for NICAN, but what about the middle schools?
So this isn't so when I put in the search for Narcan protocols in middle schools, this is going to bring up research around having Narcan in middle schools. what's been studied, how they've done it, programs like that. It's not going to come back with specific recommendations, and it's not going to come back with protocols that are it's not going to come back with requirements. So, you know, the state of Vermont might require schools to have that. That would be a search not through PubMed, but through your local school district or through the state's Department of Education. But this will, so if you think that it would be a good idea to have Narcan in the middle school, you could run this search. And unfortunately, my filters are not giving me anything. Oh, here we go. So you could run this search and find articles that could support your position. So if you're saying, I think that it would be very important for us to have Narcan in the middle school, you might be able to find research that other people have done that said, you know, we had Narcan in this middle school in, I don't know, Colorado or whatever, and we used it this way and we trained our teachers this way and it had this positive impact. And then use that research to support your position to say, we should do this too. And not the very basic quick search that I ran, I'm not seeing anything that necessarily is applicable to that situation, but that is one of the things that you might use PubMed for, is if you have a position or something that you want to advocate for, this is a good place to find research that may support that position.
And Sarah, if I can add, so if you're looking for something like that, so the National Association of School Nurses has a position statement on the naloxone in the school setting, which I put the link in there. And I see Becca also put a toolkit in there. So you can always go to NASN.org and look on the website. There are places under resources that might help you find some of those things too. That would be more specific to school nursing. It wouldn't be state specific, but it would give you a good starting point to then maybe build something that would be helpful for instance, having Narcan in a middle school versus a high school.
Okay, thank you.
So I also just switched over to Medline Plus to see what was there as well. Because that is a place then, if you do end up having naloxone or Narcan in the school, you could find information for students and their families that would be useful to them about, you know, what it's used for, why in the school, things like that. Patient education kinds of materials.
Any other questions for Sarah?
So I do have two other resources that I think folks might be interested in, not full live demos, but I just want you to know that they are available. The first is the History of Medicine Division from the National Library of Medicine. And so this has films and documents and let's see, archives, prints and photography, various collections, digital collections. They also have exhibitions. And so these are traveling exhibitions that you can actually get at your institution. But one of the things that's most interesting, I think, for our purposes today is that all of the traveling exhibitions also have lesson plans with them online. And so should have opened that first, but let's see. Yes. And so even if you're just looking for something interesting that the students might be interested in. They have information about that's related to the traveling exhibit, things like that. And then
So Sarah, I put in, maybe you could look up Lillian Wald. That would be a historical nursing figure for school nursing.
So I will definitely do that. I think the other thing is, and I didn't pick a good example of the exhibit, but there are, like I said, lesson plans with the various exhibits, and those can be used by anybody, and they run usually, some of them have elementary school age materials, but most of them have middle school, high school, and college materials for those age groups as well. So. Let's see. History of medicine. Oh, why? Okay. So, the history of medicine division, actually, I just searched the entire NLM catalog. But you can refine it by history of medicine division, things like that. And so you can find a picture. Nope, not a picture. That was a.
It might pop up as Soph Hall since she dressed up like her a couple years ago.
That's my Halloween costume this year too.
So there is some information, Lillian Wald in Public Health Nursing, in American Women of Nursing. So one of the things that I did think, nope, that's not it either. Sometimes you will find, if you search a specific person, images as well. And all of those images are open access. They are all without copyright, although there are resources to help you cite what you find if you want to use them. Which actually also brings up a good point related to Medline Plus. I mentioned that if you're looking for patient handout kinds of things and you want to use the medical encyclopedia, you can do that. You can print the medical encyclopedia page in whole. You can use it in part as long as you cite the resource that you're using. And so, one of the things that sometimes it's hard if you're trying to make a handout that is specifically applicable to, your students, their families, and make it at a readability level that is appropriate for folks. These are things that have already been written at that level. And so you can, use that language, all or in part, to help you create those materials. So I'm going to stop. Nope, not stop sharing. I'm going to switch back to my PowerPoint real quick. I did have a couple of, if folks wanted to try things out, my slides can be sent around if folks want them, because there are a couple links on there. And so if you want to use the exercises, the prompts that I used, and then if you have any questions about PubMed or Medline Plus after that, feel free to reach out. The other thing is that we have multiple ways to keep up with us. Social media, our newsletter comes out weekly. That's what this link is, and with the two people chatting. It comes out weekly, and it includes, blog posts that really keep you up to date on what we're doing. It includes announcements about classes, and it includes announcements about funding and other opportunities that are available. And then this is our office-wide email address. So if there's something that, you know, somebody else could help you with, you know, feel free to reach out to the office, or you can reach out to me directly and I can send it to whoever, you know, either answer that question or figure out who might be the best person to field it. So that is the end of the presentation.
If as you're perusing these different resources, if any questions come up, please email the VSSNA executive board. We're happy to put you in touch with Sarah if we can't help you. But our next town hall will be on November 10th, and we'll be hearing about pediatric dermatology. So for all those great questions we get about what is this, what is this, what is this on our skin, hopefully they'll have some answers for us. So Sarah, thank you so much for all of your knowledge today and for sharing that with us. I think it's really going to deepen our ability to search for different topics in nursing and school nursing specifically, and different medical conditions and et cetera. So thank you so much. I think, you know, this is one area where school nurses don't have access to like medical libraries unless they're in school at the time. So thank you for showing us that there is access and it's free. And we appreciate you being here. So thank you for reaching out.
So thank you for having me. I do want to put in one last plug for focused outreach. So if anybody is in or works in those 4 northernmost counties in Vermont and is willing to share your expertise with us about your communities, I would love to set up a time to chat. Or if you know anybody who's up there that you think might be interested in participating, and you'd be willing to get me in touch with them, that would be great.
Perfect.